Now we're going to do a little dance of the peripheral nerve innervations to the pelvis. We're going to start with iliohypogastric. Iliohypogastric comes off of the top of the lumbar plexus, T12L1, and it's going to go high on the pelvis because it innervates the area above the pubic bone and the mons. Iliohypogastric. It also has a little lateral thread that goes to the side glutes. So iliohypogastric. Iliohypogastric. Then we have ilioinguinal. Ilioinguinal comes from L1, L2. It's going to wrap around the abdomen. It's going to go through the inguinal canal and innervate the vulva, as well as the upper medial thigh. Ilioinguinal. Ilioinguinal. Next we have genitofemoral. Also comes from L1, L2, but genitofemoral is going to actually pierce the psoas. Pierces the psoas, comes through the inguinal canal, also innervates the vulva and the anterior thigh, anterior upper thigh. Genitofemoral. Genitofemoral. We have the obturator nerve. That's L2, L3, and L4, and that's going to innervate the sensory input of the inner thigh, as well as the adductors, and one of those external rotators. I always forget which one. Obturator externus, I believe. We have lateral femoral cutaneous, also L2 through L4, innervates the lateral aspect of the leg. And we have posterior femoral cutaneous. Posterior femoral cutaneous innervates the back of the thigh, but it also has a perineal branch that's going to go right to the perineal region of the pelvic floor. So, obturator, lateral femoral cutaneous, and that nerve goes underneath the inguinal ligament right here, lateral femoral cutaneous, to innervate the lateral thigh. Posterior femoral cutaneous, don't forget it has a little nerve slip that goes to the perineal region. And of course, who can forget about pudendal nerve, which innervates the saddle area. S2, 3, and 4 keeps pee and poop off the floor for pudendal nerve. There's a dorsal nerve to the clitoris or the penis that goes anterior. There's a perineal branch that goes to the perineal body region, and there is an inferior hemorrhoidal branch that goes to the posterior pelvic floor and the anus. And that's the nervous system, peripheral nerve input to the pelvic region.